All right, so there's a thing called clicking or clunking during hip movement. So hip movement, and as you are trying to move, you are hearing some funny sounds. You understand? So that's what is called a clicking or clunking movement when you want to move with the hip. So for clicking and clunking, it's also known as what? Coxa Saltans. It's also known as Coxa Saltans, right? So yeah, of course, when you hear the sound is not a disease by itself. You understand? It's actually what? It shows you that there's another disease causing it. Do you understand? So it's linked to a condition called the snapping hip syndrome, also known as the Coxa Saltans. It's common in people that use their hips so much, like dancers, like athletes, all right, anyone doing repetitive hip movements. Okay, so for what we got next, we said that what's happening if it is problems from the external. It could be that the iliotibial band is snapping over the greater trochanter of the femur. If it is issues coming from inside, it's the Iliopsoas tendon. Do you understand? That sometimes it could be within a joint. The ligaments there, the labrum there is kind of like tearing up. Okay, so things are loosed up. You understand? That's what they call loose bodies. All right. So symptoms to watch out for is the audible sound. Okay, sensation of hip catching or giving away. Pain or tenderness, discomfort when the person lie on that side that is affected, to show you that there's something under irritating it. So diagnosis and evaluation is physical examination. Of course, I'll tell the patient to lie down. I'll try to look at the range of motion of that joint again. Imaging, or either MRI, ultrasound to rule out labral tears. All right. So differential diagnosis, many things that could make the hip kind of like make out these sounds, things that you should be suspecting first. Things like bursitis, tendonitis, then maybe there's a dislocation of the hip. That's a hip dysplasia. Okay, so treatment options is physical therapies, stretching, anti-inflammatory drugs. Then sometimes if you are dealing with a dislocation, you have to do a surgery to rearrange it.